Retained placenta. The thing is, once you give birth to a baby, all right, you deliver the baby. Then there's also what is known as a delivery of the placenta. All right. So sometimes if the placenta doesn't follow suit after you deliver a baby, it remains in the stomach. That's just what is known as a retained placenta. So this one, it occurs when the placenta or part of it is still remaining in the uterus. Okay. 30 minutes or more after childbirth. So the placenta is supposed to follow immediately after you deliver the baby. Do you understand? But if you're having difficulties in delivering the placenta, or the placenta doesn't follow by itself, that's what is known as a retained placenta. So it's potentially a serious condition, so it will usually lead towards heavy bleeding. All right, there's a risk of infections too, because the woman is still open and all of that. Instead of delivering the placenta and basically you guys clean up. So placenta adherens, these are the types. So the placenta doesn't contract enough, okay, to be expelled. Trapped placenta, is that the placenta detaches but gets stuck behind the closed cervix. All right. Placenta accreta, we said that the placenta abnormally attaches deep into the uterine wall, so it is too deep for you to actually even bring it out. Okay. So risk factors, like what to predispose a woman to this type of condition. It could be that the baby was delivered not at a time when it's supposed. Okay, so the placenta is still attached because the baby is not supposed to be out by now. Maybe women have been having several issues like this. Maybe it's multiple births. Okay, maybe the person has had uterine surgeries or some complications in the stomach before. Maybe the labor was prolonged or the baby was given birth to dead. So symptoms is heavy bleeding, fever, foul smell, discharge, severe abdominal cramping. There's delayed milk production because the woman is stressed. Okay, so these are the treatments. If the woman breastfeed, it produces a lot of oxytocin. Oxytocin will induce the contraction. Changing positions, oxytocin injection, manual removal, then also some surgeries if it is too deeply embedded.